Allergist, Dr. Giri Dandamudi. Good afternoon.
Good afternoon, partner. It's always nice to come and talk to you.
Yeah, great to have you here. As you know, Dr. Dandamudi with Asthma Allergy Centers, but now a published author. Congratulations.
Thank you. Thank you.
Here's the book, Hard Pill to Swallow, and it looks like it is packed with a lot of great information. But Hard Pill to Swallow, what does the title refer to?
See, healthcare is $5 trillion. 1/5 of the economy is spending to healthcare, the public or private. It's big. So if you see people are complaining. It's not healthcare is broken, but people are always complaining. I don't get the services I want. So imagine healthcare is a service. Basically, it is a service. The patient is the prime. Patient is the one. Now the patient comes last. Everything else comes first. So it's kind of patient-driven healthcare. So that is the idea of bringing the patient in the forefront.
Now you've been, I would say, a leader and at the forefront of some new therapies, new approaches in treatment of allergies, asthma, and immune disorders. And I think that probably, by being first, you've probably had detractors that have been slow to adapt your way of thinking.
Yeah. No, but what I want to do is, so think of completely differently how you manage this $5 trillion industry. So take the pieces what you have. Don't dismantle completely, but see this one. If one thing that drives the healthcare is the money. So Social Security, for example. So the money was given to you. You are spending the money. The government is not buying you a house, but not buying you food, not buying you anything. Similarly, give the money to the patients, like health accounts.
The way the system works now in terms of insurance coverage, an insurance company will tell you how much they are willing to pay for a procedure or for a medication. Is that backwards?
Yeah. See, 30% of $5 trillion, approximately 30% is going to manage who gets paid what. 30%. Almost $1.2 trillion. So take away that. Just give the money to the patient.
One of the things that I think alarmed people in the last few years was the rising and dramatic rising of the cost of treatments for allergies like the EpiPen. That was $1,000 at one point, and obviously the medicine and the plastic, it cost nowhere near that.
So the EpiPen, before the EpiPen, I used to take a syringe and draw this one, and then I put it in what dose that I want to give, and put that label on it, and put it there, and put an envelope, and I used to give the free for the patient. Only thing, there's a needle. Hey, if it's an emergency, they go and enrich. This is a small needle. So I gave it free. It cost about maybe $5. Maybe. But now this costs $400. So instead of picking here and there, so I think we have to change the whole thing, deregulate the whole industry. The single license for the doctors, nurses, hospitals, pharmacies, national level. Why you need a license in Michigan? It's the same people all over the country, all over the world. Why can't I practice all over the country with a single license? I would like to, play golf in Florida and see some patients there, and then come back and see some patients here. So now the technology can keep all your patients into one site.
How about the regulations like that are inhibiting people from being interested in a medical career?
No question. Medical schools has to change. That's what I wrote in the book. Why you need four years of medical school when ChatGPT tells you everything, So you have to change. You need not think everything. So use the technology for training, for treating, everything. So you cut down the time you can bring the doctor out. I wrote down how you can bring these doctors into the practices more quickly, and then more with less money.
Yeah, doctors are coming out of medical school with $200,000 in debt.
So if you can get them away early 1 year, and then 1 year less residency, they will come to into the field, earning 2 years before. That pays for the health education, medical education. So there's a lot of things that I touched medical schools, I touched hospitals, I touched the insurance. What insurance companies will be out of business if the patient is going to get the money. So what they do is they can develop some medical malls, like malls where they can build them, and the doctors can go and work over there. Nurses can work. Everything can be out there. There should be an outpatient, more presence, and don't push everything to the hospitals.
I haven't had a chance to read the book, but one of the things I'm interested in hearing about, maybe you can touch on it this afternoon. You started really not in, I'd say, humble beginnings in rural India. How did you end up as a successful allergist in the United States?
Well, my thing is always about the patient. Where is the patient? The more patients are there in the rural areas than urban areas, because a lot of doctors are there. So that's what it is. Then I thought, having a satellite clinics, I can go there and see 5 new patients. So that's why I started all these Jackson, Kalamazoo, all the South Bend, all over. So that's why I started all my clinics. And then then the technology came in. It combined everything into one place.
What got you into being a doctor? How did you decide you wanted to be this doctor?
Well, my dad decided actually. He said, "You're going to become a doctor." So in those days, that's it. So we went to became a doctor.
That's the way it was.
Yeah, that's the way it was.
You would have been a disappointment.
Yes.
If you had not chosen this path.
Yes, my dad would have been disappointed.
Was he a doctor too?
No, he's a farmer.
Okay.
Yeah, farmer.
Well, he must have been very proud of you.
Yeah, he's not there anymore, but he's always said there's only 3 things matter: so your hard work, your vision, and then how you implement it.
Well, since it's September, we're at the beginning of another season of change. Where are we in an allergy season right now?
Ragweed is coming pretty soon.
Yeah.
Yeah, it's almost the end of it now. Then the molds comes in there. Yeah.
There's
always be allergies in the environment.
We've seen, and one of the things I wanted to ask you about, because we talked a little bit before the show, the director of the Federal Health and Human Services Agency, Robert F. Kennedy Jr., he's not a doctor, and he's had some very controversial decisions. What do you think about that department not being run by a medical practitioner or provider?
Yeah, I don't know that part of it. I can't comment anything. But this question is about the vaccinations. But every time they talk about vaccinations, they put in one bucket. There is vaccinations which are killed vaccines, which are safe, not as effective. That's why you give frequently. There's live vaccines. There's mRNA vaccines. There are so many varieties of vaccines, and you can't put everything, say, oh, this is bad, you can't do that. So if really vaccination is going to be the future, you really have to do a lot of open research.
So a vaccine like the polio vaccine, it's on a completely different level than a flu vaccine.
Yeah. No, it is different. Polio is live attenuated. So it's a bacterial vaccine. So it's not as virus is different. That's what they are mostly talking about now. This COVID virus. That's basically they were talking about.
So the polio vaccine is an eradication of polio, the results of that. If we back off on that, do you have concerns?
No, nobody's saying that. So that's the reason why, So they're all talking about the, viral vaccines mostly, the new vaccines. The old vaccines, the only controversy in the old days is the measles vaccine. Other than that, there is no controversy with the DPT, where polio, all the all the older vaccines.
This book is available right now. I believe it's on Amazon and wherever books are sold. It was just out this past month, so check it out, and I'll look forward to reading it myself. Thanks for coming in today.
Thank you. Yeah.
Congratulations on your book.
Thank you.
Yes.
Yeah.
The author of Hard Pill to Swallow and immunologist at Asthma Allergy Centers, Dr. Giri Dandamudi.